It is 8:13 on May 13th, Thursday, May 13th, and finally a break in the weather. The dew points are down, the humidity is lower, highs today only of 79, pretty much same thing for tomorrow. Sunny and nice on Saturday, highs of 84. And for the most part, dry on Sunday, maybe a shower here or there, and highs of 86. We are happy to welcome in Dr. B, Dr. Brent Wallis, our friend, Chief Medical Officer of People's Health, to talk about senior health, and really today's topic applies to everybody. How you doing, Dr. B?
Hey, Tommy, I'm doing great. How about you?
I'm okay, and it's great to have you on again. A lot of people have high blood pressure. They don't know it. High blood pressure, hypertension, pretty dangerous because there are often no symptoms. And Dr. B, you're going to try to help us learn about it here because it's High Blood Pressure Education Month, right?
Yeah, definitely. Yeah, this is probably one of the most common things that we see in practice every day.
What exactly is blood pressure? Because we use the term all the time, but I don't know if I really know what it is.
Sure. It's pretty simple. It's the blood pressure is the force or pressure that your blood is pushing against the walls of your arteries. And what we do is we measure it. That's when we put the device on your arm and pump it up. And it gives us two numbers, a systolic pressure and a diastolic pressure. So one is the top number and one is the bottom number. So that top number, or systolic, is the force of blood when your heart's beating, and the diastolic, or the bottom number, is the force of blood when your heart is relaxing. And so we look at those two numbers to kind of determine either how narrow your arteries may be or how hard your heart is pumping and trying to get that blood moving around.
I never thought about it, but I guess it's kind of like a hydraulic system almost?
Yeah, very much. And, a lot of people don't realize that bottom number, your heart, even when it's not pumping, blood is still moving through your blood vessels. So that's why we get those two different numbers.
What is a good, quickly, before I get to this, when I have high blood pressure and I take medicine for it, but when I go and they ask it to a doctor and they say, well, do you have high blood pressure? I don't know how to answer because I take the medicine so I don't have high blood pressure. But without the medicine, I would. So what are you supposed to put on a form?
Yeah, you definitely should tell them that you do have high blood pressure. It's just treated, so that's a good thing. So even though you're taking medicine for it, you still do have the condition.
So the answer would be yes, I do have high blood pressure.
Yes, definitely.
Okay. Even though I don't actually have it, it's the condition, not the pressure at the time. Speaking of which, what is a good blood pressure reading?
Yeah, so the target that we tell everyone is 120 over 80. So 120 for the top number and 80 for the bottom number. Anything at or below that is considered normal. But when you start creeping up, that's where we stage the degree of elevated blood pressure that you have. So the first stage is considered elevated when you're between 120 and 129. And then it goes up to stage 1 high blood pressure when you're 130 to 139, and then stage 2 of high blood pressure when you're 140 and above. And the one thing to keep in mind is sometimes you can have an elevation in that bottom number as well. And that bottom number, anytime it gets up into the 80s and 90s, that's of concern. So that's something that can be a little bit dangerous, so you want to make sure that your doctor knows about that. The other thing I always try to make sure people know is our blood pressure goes up all the time. You get scared, you're worried about something, especially when you go to the doctor. So one single high reading doesn't mean that you have high blood pressure, that you have hypertension, the actual disease. Mm-hmm. It needs to be checked usually multiple times, and if it's consistently high, then that's where it's an issue.
So when your mom used to tell you, you're getting my blood pressure up, you really were, but not given her condition, right?
Yeah, and that's normal. During the day, a lot of things, driving around town sometimes will raise your pressure, but it doesn't mean you have the disease.
Gotcha. What are some of the symptoms for high blood pressure? I mean, if there are no symptoms, how do you know if you have it?
Yeah, that's the issue with high blood pressure is that most often you don't have any symptoms at all, and so that's why it's so important to go to your doctor and get a checkup, in a routine basis. So when you come into the doctor, the first thing we usually do is we check your vital signs, and one of those vital signs is the blood pressure, and we do that at every single appointment that you come in for the most part. But because it's so common, it's something that really needs to be addressed. Probably about 1 in 3 Americans has high blood pressure. But once you get above age 65, it jumps dramatically. Probably about 70% of seniors have high blood pressure. So if you are a senior and you've been putting off your doctor's appointment, especially during the last year or so, you want to schedule that appointment so we can check your vital signs. We've been doing a lot of telemedicine over the last year, and unfortunately we can't check blood pressures, over the internet. So that's why it's so important to see your doctor to determine if you might have elevated pressure.
I have a teledoc appointment at 10 o'clock, and I've already taken the blood pressure machine out so I can give them the readings. And along those lines, are those machines pretty accurate?
Yeah, we always say the machines themselves are reproducible in that they're going to give you values that make sense value to value, but sometimes they need to be calibrated. So I always ask my patients to bring in their machine so I can compare it to the one that I have on the wall, because sometimes there can be a discrepancy between the two.
So how can that affect your health, high blood pressure? Is it back to a hydraulic system where it basically, if it's under too much pressure, the parts of it fail?
Yeah, if you consider your blood vessels the pipes, then too much pressure on those pipes can cause problems, and it can cause anything from heart attack or even stroke. Sometimes we'll even see heart failure, which is when the heart has to pump so forcefully and so hard that it really fails. It can't do that. Excuse me. And so it can also be caused by other conditions like thyroid problems or sometimes kidney problems. So high blood pressure itself can actually be a symptom of something else going on. So if you do have high blood pressure, you have to kind of talk with your doctor so they can determine what the cause is and then what the treatment may need to be.
This is really good information for everybody. It's High Blood Pressure Education Month. Dr. Brent Wallis from People's Health, Chief Medical Officer of People's Health, is educating us about it. When we come back, we'll talk about who is at higher risk for high blood pressure, what lifestyle changes can you make to help it, and are there certain foods you could avoid or should avoid. 8:20, time for traffic now on WWL. 8:24, Tommy Tucker, WWL. Talking to Dr. Brent Wallis, People's Health, Chief Medical Officer, about High Blood Pressure Education Month, and that's what he's doing. Tim at Master Control, doctor, told me his aunt went to the emergency room yesterday. Her blood pressure was 240 over 120. That's pretty serious, is it not?
Yeah, that is definitely serious and something that needs to be addressed right away.
At least you went to the emergency room. Who is at higher risk for high blood pressure?
Yeah, so like I was saying, the risk goes up as you get older. So seniors in particular do have a higher risk than younger people, but really family history plays a huge part in elevated blood pressure. So if your parents or your brothers and sisters have high blood pressure, then you're much more likely to develop. And then the other trend we see is in race. So more than 40% of African Americans have high blood pressure, and sometimes they actually develop more severe blood pressure than other races do as well. It tends to be earlier as well. And then weight definitely plays a factor. So people that are overweight or obese or physically inactive have higher blood pressures. We say this all the time. Tobacco is very bad. Smoking increases your blood pressure. And actually excessive alcohol use can as well. And then diet plays a really huge role. So in particular, salty foods that we love so much in Louisiana can really elevate your pressure. And then the other big factors we look for is other diseases. Things like diabetes, thyroid disease, or kidney disease can lead to increased pressure as well.
For the love of God, taste it before you grab the salt shaker, please. That's all we're asking, right, Doc?
Yeah, that's right.
Just
I always say
it.
Cook with it, but don't add it.
There you go. That's a good phrase there. So what lifestyle changes can we make to help with blood pressure?
Well, definitely maintaining a healthy weight, and part of that is eating better, making sure you get lots of fruits and vegetables and whole grains. That really helps everything, with your health. And then exercising is critical. Exercise really helps to lower your blood pressure over time, even absent of actually losing weight. So we usually say to try to get at least 30 minutes of movement about 5 times a week. And then please stop smoking and try to reduce your alcohol intake, because both of those will actually really help to improve your blood pressure.
We already talked about salt. What about certain foods that are just no-nos?
Yeah, there's a lot of foods that have salt in them that people don't realize, and so you have to kind of look at the labels. But there's a few things in particular that almost always have elevated salt, and you may not even taste it when you eat the food. So anything that's canned, the canning process, they usually use salt to preserve the food. So soups and meats and things like that, and then any cured meats, in particular like ham or bacon, sausage. Hot dogs in particular have a huge amount of salt in them. You do have to watch some other things you may not think about, though. So, things like oatmeal can have salt added to it. Pancake mixes can have a lot of salt in there. And then even the butter that we get, you can get salted or unsalted, so you have to watch those. And then obviously the snacks that people eat most, chips and pretzels and salted nuts obviously have a whole lot of those. So you want to try to avoid fast foods or prepackaged foods. Those are usually going to have really elevated levels of salt. So you need to try to find some options that are a little fresher, not preserved, and that's going to be much better for you.
And as you say that, you make me crave everything that you just talked about. If you are taking medication for high blood pressure, I presume it's very important to keep the routine going?
Yeah, and we can't say this enough. When we put you on blood pressure medicine, your blood pressure is going to get better. That's the goal. And just like you were saying earlier, once your blood pressure is normal, a lot of people have the tendency to say, oh, well, I'm fixed. I don't need to take the medicine anymore. But you're actually having a much better blood pressure because you're taking the pills. So you want to continue taking them even when you feel good, especially when you feel good. Don't change the way you dose it or the time of day you dose it without talking to your doctor.
And you all have a virtual presentation coming up, right, about blood pressure?
Yeah, we do. We have a very good virtual presentation, kind of talks about a lot of the things I did, but expands on them as well. It's going to be next Wednesday on May 19th at 10 o'clock in the morning. So you can actually sign up for that event online at peopleshealth.com/wellness.
Can you change high blood pressure strictly with diet or exercise, or do you need medicine most of the time?
No. Actually, you definitely can eliminate high blood pressure if you exercise, maybe lose a little bit of weight, and then diet, like I said, plays a huge role. So it's really preferred that we want to treat it with something like diet and exercise than having to put you on a pill.
And don't eat all of those delicious things you were just talking about.
Yeah, moderation. So, it is when it's gumbo and crawfish season, just don't eat it all.
Yeah, try not to. Thank you, Doctor. A pleasure as always. You have a good weekend, okay?
Thanks, Tommy. You too.
All right, so a virtual presentation about high blood pressure, May 19th, 10 a.m. You can sign up for it at peopleshealth.com/wellness. And you can always find out more about People's Health at peopleshealth.com/radio. You can call 1-866-687-7335. And, of course, you can always follow People's Health on Facebook, Twitter, or Instagram. 8:30.